HIV transmission and prevention.
Yes? Oh, Liz, it's you. Come on in. How are you? I thought you should be in school right now.
Wow! Which question do I answer first? Well, I am very fine, Daktari. Today is sports day in our school, so I decided to stay at home.
I see. I'm glad you came. At least not talking to patients for a while. Sit down.
Thank you.
How is your sister, Nancy?
Oh, she's doing just fine. Are you free right now, Daktari? I can always come back another time.
No. It's okay, Liz. I can always make time for you. Besides, that's part of my job to give information on HIV and AIDS.
Glad to hear that. Well, if HIV does not spread by sharing items, then how exactly does one get infected?
Good question. Now, HIV can enter the body directly via the bloodstream or through the mucous membranes such as the vaginal or womb lining, urethra, or inside the foreskin of the penis and via the lining of the anus.
Passing it via bloodstream makes sense since the virus lives in the blood. But I don't understand how you can get it through the vagina, mouth, or anus.
All right, I'll explain. Well, once HIV is present in the body of an infected person, it is found in fluids such as semen or seminal fluid, vaginal fluid, breast milk, blood, including menstrual blood,
Oh,
as well as rectal secretions or mucosa.
rectal secretions?
Rectal secretions are the fluids that come out through the anus.
And this will happen through sex, I guess.
Definitely. Unprotected sex, to be more correct. It is actually the main cause of HIV transmission from one person to another. There are 3 different types of sex, namely vaginal, anal, and oral sex. Anal sex has the highest risk of HIV infection because the lining of the anus is more delicate than the lining of the vagina and is more easily damaged. Unprotected oral sex, on the other hand, has the lowest risk of HIV infection unless there are large open wounds in the mouth.
I see. Do you mind explaining these types of sex a little further?
I don't mind as long as you are okay with it.
I wouldn't have asked if I wasn't.
Alright then. Vaginal sex refers to the penis in vagina intercourse. It is the most common. Anal sex is penis in anus intercourse, while oral sex involves mouth to genital, penis or vagina in that case. Any questions?
No question. I think I got everything.
Good.
What about other fluids like saliva? Isn't HIV not present in them?
HIV is present in saliva, but the enzymes in the saliva protect the cells from being infected by the virus. Unless there is visible blood in the saliva, it is not considered a body fluid through which HIV can be transmitted. That is why I said there is no problem kissing someone with HIV unless both of you have large open wounds in their mouths or bleeding gums.
Good to know. What about tears?
The same applies to sweat or even tears. These fluids have very minimal chances of transmitting HIV.
Nice. So, to prevent catching HIV, you should have protected sex with your partner. Am I right?
Yes. Use a condom every time you are having sexual intercourse with your partner. It reduces the risk of catching the virus a great deal. Anyway, this is just one way of preventing HIV infection. Another way is abstinence. This involves avoiding sexual activities completely.
That sounds pretty straightforward. It's the only way you can ensure you are not infected. I can settle for it.
Good for you. Reducing the number of your sexual partners also lowers the risk of catching HIV virus.
That makes a lot of sense.
And finally, avoid the more risky sex activities such as anal sex.
That makes sense too. If I prick my hand with a needle that has been used by someone who is infected by HIV, I will definitely get the virus, right?
That's definitely very risky thing to do. Sharing injecting equipment like needles and syringes to inject any type of substance can transmit HIV. During an injection, some blood goes into the needle and the syringe. Such a needle used by an HIV-infected person can still contain the virus after injection.
So, if you use the same equipment, then you can inject the infected blood into your bloodstream and become infected.
Very correct. So, what do you say about sharing needles and syringes?
You shouldn't share them at all. Period.
That's right. Always use new or disinfected needles and syringes. Use clean water when preparing drugs. Can you think of other ways you can get HIV infection other than what we have just discussed?
Well, I guess getting a blood transfusion can lead to infection if that blood has the virus.
That is a correct guess. Donations of blood and blood products such as an organ or tissue by an HIV-infected person can lead to HIV transmission to the person receiving it.
How do I know if the blood transfusion I am receiving is safe?
Well, in most cases, the blood product you are receiving is safe. However, if you are worried, you have a right to ask your doctor if the blood transfusion you're about to receive has been tested for HIV or not. Besides, there are international guidelines that state all blood products must be tested for viruses such as HIV.
I see. Can I get HIV by donating blood?
No, it is not possible unless the needle and the syringe that is being used to remove your blood has been used on an HIV-infected person.
Wow! You really have a lot of information, sir.
Thank you.
You mentioned before that a mother living with HIV can pass it to her unborn child.
That is highly possible. A pregnant woman living with HIV can pass it to a child during pregnancy, childbirth, or even during breastfeeding.
How is that even possible? I guess their blood don't mix.
Well, for a pregnant woman living with HIV, passing the virus in her blood is likely to happen in the last few weeks of pregnancy, during labor or delivery. Breastfeeding your baby can also transmit HIV because the virus is found in breast milk. You know that?
So a pregnant woman living with HIV cannot have a child that is HIV negative.
That is not true. Taking antiretroviral treatment carefully if you are living with HIV can greatly reduce the risk of your baby being born with HIV to less than 1%. Your baby will also be given treatment for up to 6 weeks after birth to prevent an infection developing from HIV.
What about at birth?
Well, if you take your treatment properly, and I mean ARV treatment, you will lower the amount of HIV virus in your blood to the extent that it is said to be undetectable.
I see.
This means you can plan to have a normal vaginal delivery because the risk of passing it to your baby is very small.
Okay.
But if your viral load in your blood is not undetectable, then you may have to go for a CS,
which is
a cesarean section. This is a surgical procedure in which incisions are made through a woman's abdomen to deliver her baby. A cesarean section carries a smaller risk of passing HIV from mother to baby than a normal vaginal delivery.
Got it. So a mother cannot breastfeed her baby? That sounds mean.
Mean as it may sound, let's both agree that breast milk contains HIV. Now, if you have access to baby formula and clean boiled water all the time, you are advised not to breastfeed and give child formula instead.
What if I cannot afford these formula foods?
Now, in that case, your doctor may advise you to breastfeed while both you and your baby are taking ARV drugs. But here's the catch. You must maintain taking your treatment while ensuring you practice exclusive breastfeeding.
And what do you mean by exclusive breastfeeding?
Giving breast milk only for at least 6 months.
Why?
Because mixing breast milk with other foods at this time increases the risk of your child getting infected with HIV.
But it's okay to mix feed after 6 months?
Yep. In any case, you should have your child tested after breastfeeding to find out your child's final HIV status so that you can make correct choices afterwards.
What if I had sex with someone whom I don't know his status? Which steps should I take?
Wow, that's a good question. If that were to happen, then you should see a professional doctor as soon as possible.
Then what?
Oh, that's what I am getting at.
Okay.
The doctor will give you a post-exposure prophylaxis, PEP, treatment. PEP is an antiretroviral drug given after you expose yourself to an activity that puts you at risk of HIV infection. In this case, unprotected sex. This should stop the virus from spreading in your body.
How soon should I get this drug and where can I get them?
PEP should be started within 72 hours of possible exposure. However, PEP is not 100% effective and therefore should not be seen as an alternative to using condoms.
Great. So PEP is used for after a possible exposure activity. Is there another form of treatment for before exposure?
Another good question. There is what we call PrEP or pre-exposure prophylaxis. But like I said, these programs are not 100% effective. PrEP is an antiretroviral drug taken daily by someone who is at high risk of HIV infection. It is recommended for people with an ongoing relationship with HIV positive partners, as well as anyone who is sexually active like yourself with more than one person, or even if they are recently tested negatively for HIV.
Someone wishes to see you, I guess.
Oh, good time for you to take a break. Have a look around our dispensary. Have you back here soon.
Sounds good.